Sometimes you, the patient, can cause an insurance to deny a claim. What are the most common reasons? Remedies and solutions, and a couple of tips to help you along. Welcome, I am the Medical Bill Whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. So what are the most common causes? Well, the first one, data and demographics, that is incorrect. Let's explore what is needed exactly using the sample of what is called a CMS 1500, a regular claim form your doctor uses. You will see there are a number of details that need to be there and need to be correct in order for your insurance system to process and pay a claim. First, identify the correct carrier. For example, in California, Blue Cross Blue Shield does not exist. It's either Anthem or Blue Shield. Is it Blue Cross Blue Shield of Florida or Blue Cross Blue Shield of Illinois? Is it Medicare or a Medicare Advantage plan through Aetna? And so on. Your insurance card will list the right name of the carrier. Next, we need to identify the correct ID number. Sometimes everyone in your family will have the same ID number, but Kaiser patients each have their own. Next, identifying the subscriber. That is the person under whose name the policy is held. Next, identifying the patient, and that means their exact name, address, date of birth, and relationship to the subscriber, spouse, child, etc. Any missing or incorrect information would lead to a rejection or denial of a claim. Next, coordination of benefit. That means your insurance needs to find out whether another policy is responsible for payment, whether you are the subscriber or another family member. More important, which one is primary, meaning they will process and pay the claim first, and which one is secondary, meaning they will receive the claim after the primary insurance has issued an EOB. Any incorrect order or missing primary EOB information will result in a rejection or a denial. So ignoring coordination of benefit is not a choice, but it is your responsibility to report. Accidents and injuries can also result in rejections or denials. Why? I know your insurance is most concerned about paying your claims as quickly and as much as possible, but they will be looking out to know if someone else might be responsible for payment. A car insurance, a homeowner's insurance, or any third-party liability. If you broke your leg while shopping and sleeping at the supermarket, for example, your insurance will ask you to explain how the accident happened, who is responsible, and, well, is there somebody else paying that bill? So if you do not respond, expect a denial or rejection. A fourth common reason is, again, is someone else paying the claim? And this time, if you injured yourself or had an accident at work, that is called workers' comp. Your employer must have a special insurance for injuries or accidents happening at work while you are an employee. So your health insurance will be rejecting those claims if they presume or assume that there is workers' comp liability. And last but not least, missing information and or documents. For example, if you switched insurance company or plan, your provider must be given the new information and must send either a corrected claim to your insurance or send the claim to the correct insurance. But if you submit invoices yourself for reimbursement, and that happens in most out-of-network claims, well, make sure that all the demographics information is there and is correct. And make sure also that the billing information with proof of payment is attached. And if you did not return a questionnaire, whether asking you for coordination of benefit or injury details, please do so as soon as you can. Yes, you can call, fax, email, send a message through the online portal, or even possibly send a pigeon carrier, but do it. And of course, down the line, maybe 30 days later, make sure that any denied or rejected claim has now been processed. Because if the systems are not updated, well, you will still get the same rejection or denial. So the coordination of benefit may be correct with your insurance, but if no one in that department has alerted the claims department, well, your claims are still sitting there while you receive bills from medical providers. Of course, there are remedies and solutions. For data and demographics, it's simple. Give the right or updated information to the right person all the time while wishing and hoping that they do their job and that eventually, voila, your claim is paid. Coordination of benefit will involve you getting the right order of who might be primary and secondary, then returning the questionnaire or informing every insurance company of the others. Unfortunately, the order is not your choice. It is not your preference. There are very strict rules as to who is first, second, and so on. For example, Medicaid usually is always last, but Medicare can be primary or secondary depending on, for example, the size of the company. Your children's order of insurance may depend on each parent's month of birth, not year, not day. And if you have two employers with two different insurances, well, the date start of each enrollment will also determine which one is primary and which one comes next. The good thing is, if you tell each insurance company about the other or others, they should be talking to each other and determining themselves the correct order. If you have an accident or injuries, you should know who is responsible, right? In that case, return the questionnaire and indicate the responsible or liable party. For example, a car insurance. Now, I understand in many cases you may not know if the other driver's insurance will cover your medical bills or if the supermarket has any kind of liability coverage. In that case, indicate so on the questionnaire. Your insurance can pay the claims for an accident, then get reimbursed later when or if you receive a settlement. They may ask you to sign a lien or sign one with your attorney that promises to pay them back if and when you receive a settlement from a third party. Workers' comp claims are a little bit different. Your employer becomes liable for payment of your medical bills, not your health insurance. But for that, you will need to open a workers' comp claim and bill the workers' comp insurance directly. Your health insurance will recoup payments that they make on your behalf if the case proves to be workers' comp. And many medical providers do not accept workers' comp cases. Why? Because the process of getting paid is trickier and often delayed. It involves the acceptance by your employer and the insurance that this is indeed a workers' comp claim. And in many cases, especially for example in California, pre-authorization is required for any and all services. For those missing pieces of information or documents, think of them a little bit as ingredients when you bake a cake. If you don't have one of them, your cake will not rise or will ruin a birthday. You don't want an empty plate. or a denied claim, make sure all the ingredients, all the information, all the documentations have been submitted to your insurance and are correct. As for tips, trust, but verify. I know you shouldn't be doing this work. This is the office's job, or it is the insurance duty. But when you give information to someone and a system has to be updated, you must follow up. Even if, again, coordination of benefit has been updated, it doesn't mean the claims department knows about it. If the receptionist at the office has taken a copy of your new insurance card, it doesn't mean that the biller was notified. Confirming every step is a nuisance, but necessary. Timeliness is not on your side. When you return a questionnaire, make sure that it is within the 10 or 15 days your insurance gave you. If you don't have answers to all their questions, send it back with a little note or a letter explaining why you don't have all the information yet. And keeping a log is a must. Who did you speak with? When? Why did you call them? What did you request? Evidence is power in my book. Should anything not be properly processed and paid down the road, or even denied again, that information pointing the finger at somebody else not doing their job may well be the difference between you eventually getting that claim paid or you getting another bill. I so thank you for watching. This little channel keeps growing with every comment, with every subscribe, and with every like. So thank you for those.